For me especially, what I'm interested in is reading disability and reading ability are highly heritable. What we do now is we wait till kids get to school, they fail at reading, and then we try to do something to fix it. You could predict which kids are likely to be at risk. And we already know that almost all kids who are reading disabled had language problems earlier. You can't do reading interventions in 3-year-olds because they can't read. But you can do language interventions because there's very good language programs. But an important point is most successful interventions are expensive and intensive. So you can't do them with everybody. But if you could identify the kids who will be at risk for reading, you could intervene with language. And it wouldn't hurt them. It's not like giving them a drug or something. It's only good, to have people helping you with your language. And then when they go on to school, they'll be less likely to have a reading problem. So all of science, medicine now is focused on predicting and preventing problems, rather than waiting until the problems occur and then trying to fix them. So this is beginning to happen now. People are doing it on their own. So lots of people are doing it, and they're beginning to do it for their children. The reason I think it's important to get this message out now, before it really hits the ground, explaining 10% of the variance is a lot. If you want to predict like school achievement, what would you use to predict that? Nothing else will get near this 10%. 10% is a lot, but we've just begun. People don't even know about this yet. But when they do, I think they will begin to take genetics seriously in education. Right now, they totally ignore genetics. And I think there are some very good things, there are good discussions that ought to begin now before this really becomes reality, even though it's getting close to reality already. And I think, a lot of people say, how terrible this is. Imagine you're going to predict which kids have reading problems. I think that's good. Now, there's a lot of doom mongers who say, oh, you label kids. Well, kids get labeled already. There are problems. We got to discuss those problems. But I'm a cheerleader for this. I think we can do a lot of good at predicting and preventing problems from occurring. I'm really into this because I want to be able to predict genetic strengths and weaknesses at the individual level. That's been a revolution, and it's just now reaching a point where we're identifying some of the genes to be able to make individual predictions. And this isn't just psychology. This is all of the life sciences. They've all come to this position.